My name is BSanchez, and for this presentation, I will be focusing on Freetown, which is Sierra Leone's capital. Sierra Leone, despite being super rich in natural resources, is a very poor nation. As a result of this, it has very weak infrastructures, including the healthcare system there. After the Civil War, which ended in 2002, the healthcare infrastructure was very weak, and then it was just further weakened in 2014 and 2020 with the Ebola epidemic and then the COVID pandemic. As of 2020, there were under 15,000 community health workers and under 5,000 skilled health workers across the nation. However, the corruption and just the way that Ebola and COVID were handled in the community did lead to the loss of trust that community members had in the healthcare system, particularly for those who lived in informal settlements, also called slums. As discussed in class, one of the big social determinants of health is access to healthcare, and there are layers here that lead to worsened health outcomes for Sierra Leoneans, mainly that they have very little resources to begin with, and then culturally there is no trust in the establishments. And then pictured here is just a girl who is young. I think she's like 18 in the picture, and she is just in the ruins of one of the informal settlements in Sierra Leone. So focusing a little bit more on urban communities like Freetown, 49% of Sierra Leone's population lives in urban slums or the informal settlements. People who live in these settlements lack access to clean water, to bathroom, hand washing stations, and because of this and overcrowding, disease is very infectious in these areas. Diarrheal disease in particular, like cholera, is very prevalent as well. And like mentioned previously, because of that distrust of medical professionals, people are not seeking care even if they are sick. Community health workers, though, they are very crucial for these communities as they are seen as trusted community members, and they are also more likely to treat people living in the slums as people and respect their dignity. However, despite the need of the community health workers, due to various barriers, the community health workers in urban areas are the most underperforming in Sierra Leone. Here is just a picture of kind of like what these slums look like and what people are living like. As you can see, there's like flooding and everything, so just very unsanitary conditions. But overall, this brings me to my next point, which is my foundation, the Frontline Foundation. It is designed to be an organization that helps Sierra Leoneans overcome the barriers that keep them from becoming community health workers. It is based on the ideology that only the community itself can truly know how to help itself, and we just want to help them by giving them the tools to kind of get started. Overall, the foundation wants to promote community unity and giving one another inspiration and motivation to grow and develop. I will say it's also very strongly based on the idea that community members will help one another if given the chance, as per Mr. Lycan's lecture from a couple weeks ago, and then the multiple interviews with community health workers who have said that their motivation for doing what they do is that they have experienced such loss and hardship, and they want to change that for others. The name of the organization is a bit of a double entendre here, with the front line being like the workers who work, like our first defense in action. We heard it a lot with COVID, first responders and essential workers. And then per the Oxford Dictionary, being on the front line means that you are at the forefront of new developments or ideas, and that is what we want to encourage community health workers to be. We want them to start change from the bottom up, so to speak, educate the community about health and advocacy, and then kind of just show the community that they can trust medical professionals and kind of maybe even inspire them to become healthcare workers themselves. The hope is that eventually the community will be able to set forth their own community-driven programs, and they really can't do this, though, until the more basic needs get addressed, which is what the community health workers are going to help them attain. To further reflect on this kind of ideology, the logo for the foundation, which is that tree there, is a symbol of Freetown, which is the cotton tree, and it is an actual tree that is in Freetown, but it is also just a symbol of unity and resiliency, and then it is also the colors of the Sierra Leone flag. So, in order to actually achieve this, we would partner with like minded organizations to really develop and make like a very expansive net of community members and resources, and also loop in community experts of particular fields. The main partnership would be with the B Rose International Foundation, which is already a trusted organization in Freetown and in the community. And the mission of them is to basically give hope, education, and dignity to the community while also ensuring the basic needs are met. Other organizations like the Sierra Leone Rising is like based on women's empowerment. Women's voices are crucial to the success of community health workers as they can weigh in on issues like pregnancy and childcare and so on. And so it would be really important to be able to promote this program to young women. The idea is also to have these organizations help with fundraising and promotion of our foundation. Our foundation itself would help implement literacy training and community health worker courses, and also help with financial barriers that are faced by people. Regarding the finances, I am taking inspiration from Wine to Water, where they have various sources of fundraising, and then also inspiration from the B Rose Foundation, where, as you can see pictured here, they have a sponsor a child's education kind of program, and we would want to do a very similar component where membership and sponsorship happens, and people worldwide can sponsor a clinical health worker. Any subscription member can opt in to get emailed newsletters and updates so that they can see the impact that their donations are making. And then additionally, we would want to do things like get social media revenue to go towards funds. And then we'd also want to invest in other programs like community artisanal work, in which these projects, women and disabled people can create work and it then gets sold. Most of these profits would go to the artist, but a slight portion would also go to the foundation. And then lastly, we would want to partner with bigger corporations and other companies, so like boutiques, for example, to sell these crafts, or even brand name organizations to really profit from that corporate social responsibility that we talked about. The goals of the funds raised would be to cover additional day-to-day expenses that accrue during community health worker training, so things like transportation, food, or lodging. And then funds would also be invested in improving the clinical health care worker programs and marketing the role to other people just with these new incentives. So, foreseen issues that the foundation would maybe face revolve around systemic issues that are already plaguing Sierra Leone. There is gender inequality, for example, which does affect the ability for girls to study and then work. And then overall, there is cultural hesitancy in integrating these programs, and also just the lack of trust of the medical field. The solution here would be to get trusted community members, especially like men, in terms of like the gender inequality, to really advocate for change and for women's rights. This is also why we would be partnering with community experts such as women's empowerment groups. Additionally, there are other barriers that would be faced just because of like the level of poverty in Sierra Leone. So issues like food insecurity, malnutrition, natural disasters, and so on could impact a person's ability to commit to the program. The hope here, though, is that despite the hardships, communities would want to persevere. And lastly, there are financial barriers that will likely continue because things like the stipend of the community health workers is not very much, and that is a very big deterrent in people investing in the role. Advocacy would be super huge for our foundation to do. Plus, we would want to avoid dependency, though, is the other side of the coin, just because we want the program to go help, but we don't want the communities to get too dependent and then not be able to develop in a sustainable way. So, in order to evaluate the success of our foundation, we would have to monitor various statistics and data, particularly those regarding the incidence of morbidities and mortality rates. So, kind of like seen here in regarding like malaria and the incidence there, we want to see these decline. And then we'd also hope to see a rise in literacy rates and a growth in the number of community health workers. A fun bonus would be to see if we could monitor any future interventions for community development, especially if they were led by the community health workers who benefited from our foundation. Our goal is overall to see these rates move like we want them, and then be able to retreat from Sierra Leone or divert investments into other causes. In conclusion, I do want to leave with the reminder of Dr. Chishti's TED Talk, saying how we cannot help vulnerable communities if we make the interventions about ourselves rather than them. The Frontline Foundation wants to invest in the frontline workers of Sierra Leone, as we believe that community health workers can have a ripple effect and bring change and development from the ground up.